the guidance around masks has been confusing from the beginning. And again, a part of it has to do with this idea of corrected science. And a part of it has to do with understanding how these viruses are transmitted, how much is droplet, which is fairly effectively blocked by mask, and how much is airborne, tiny microscopic particles that are suspended in air. The masks, regular surgical masks, seem to be pretty effective if two people have them on in preventing droplet transmission. What we've seen with Omicron is what we think is much more airborne transmission, much more the virus hanging in the air, much more of tiny amounts of virus that can escape around a surgical mask, causing infection. One of the reasons that Omicron appears to be so contagious is that it has very strong binding to the cells in our upper airways, so you may need a smaller amount of the virus to cause an infection than with prior variants. Omicron, as we've talked about, seems to be more like measles, super contagious just with airborne transmission. So to have the highest level of protection against something like Omicron that's so contagious and so easily transmitted by airborne transmission, the most effective way would be an N95 or similar mask. Now, again, because Omicron very rarely, if at all, produces a serious illness in someone who has a normal immune system who's been vaccinated, I don't think it's critical to always run around with N95s. If you're unvaccinated or a very high-risk patient due to immunodeficiency and you're out in public and you absolutely don't want to get Omicron, the N95 would be most effective.